Namaste. Now I am going to speak about WHO 3-step analgesic ladder. This is a guideline given by WHO to treat cancer pain. The faculty for this topic is Dr. Ruchi Gupta. She is professor and head, Department of Anesthesia, Pain Medicine and Critical Care at Sri Guru Ram Das University and of Health Sciences, Amritsar. As you know, incidence of cancer is on rise. In India, at one time, we have 26 lakhs cancer patients who are undergoing diagnosed and undergoing treatment, and out of them almost 8 lakhs patients die every year, and 10 lakhs new patients are added to these statistics every year. So, cancer has become the leading cause of morbidity and mortality worldwide. If you see the incidence of pain, almost 55% of the patient who are undergoing cancer treatment, they experience pain. 66% of the patient who has got advanced stage of the disease, they experience pain. So, WHO has developed this 3-step ladder for pain management in adult cancer patients. By this, following this WHO 3-step analgesic ladder, you can choose right drug, right dose and given at right time to the patient, and 99% of your patient will be relieved from cancer pain. It is very simple, simplest guideline can be followed by any healthcare professionals, whether he is a doctor, nurse or a medical officer sitting at PHC and CSC level. Secondly, it is affordable. It can be given to all our Indian population and almost effective in 80 to 90% of the cases. The simplest formula for this WHO 3-step ladder is you assess the pain severity and accordingly you give the drug. So, if you have proper assessment of the pain, you can select the right dose, right drug and can be given at right time. This ladder was introduced by WHO in 1986 and cancer pain relief modified WHO ladder for opioid availability was modified in 1996. Cancer pain relief in children were introduced in 1998 by WHO, and the Dolphy study report was given away in Geneva in June 2007. In children, the ladder is slightly different. You have to omit the step 2 drugs. So, for children it is only 2-step ladder and it was introduced in 2011. WHO guidelines for the pharmacological and radiotherapeutic management of cancer pain in adult and adolescent is introduced in 2018. But this simplest ladder which was introduced in 1986 is still practiced world over by all healthcare professionals. The aim of this ladder is the prompt treatment and prevention of recurrence up to in 90% of the patient who are experiencing cancer pain. And to achieve this realistic goal, there are 5 principles of this ladder. One is select the drug which can be given by mouth. As I said, cancer patient needs analgesic for very long time, for months and years together, and it is not practical to give the drug by injection. So, you should choose such a drug which can be given by mouth. So, patient can take at a home, simply can be given by a relative or patient himself, and it is convenient to carry. Second is by clock. Since cancer pain is almost continuous pain in almost all the patients, the drug should be given round the clock and not only when the patient feels pain. Third is by ladder. You decide the severity of the pain and see the ladder which drug is there recommended, you give that drug and patient will be relieved of the pain. Fourth is by individual. You have to individualize the treatment. As I said in my earlier talk, that one patient may require only 5 milligram of drug. For same pain, another patient may require 15 to 20 milligram. Because the pain differs from patient to patient, psychology differs from patient to patient, and social culture, background, upbringing, education, so many factors decides about the pain intensity, and that is why you have to individualize the treatment. Another is give adjuvant drug. There are few drugs should be given with the main analgesic to cut down their side effect, to treat their side effect, or sometimes they help, these drugs are complementary. Like along with morphine, you give paracetamol, both paracetamol is complementary to morphine, it will decrease the dose of morphine requirement. So, this is shown in picture form. First is by mouth, because it can be taken at home. Second is by clock, round the clock. Third is by ladder. You should know the 3 steps of the ladder and which drug is there in which ladder, and you give the drug after assessing the pain of the patient. Fourth is attention to detail. Whenever patient is on your taking your drug for pain management, you should look for the side effects or any complications or any problem because of your treatment. Fifth is individualized treatment. As I said, make the change as per the patient condition, patient requirement, and patient's pain. So, which step you will start first in cancer pain? If your cancer patient is having pain, you start the drug as per the severity, as I said. For mild pain, where the VAS score is 1 to 3 out of 10, you start step 1. For moderate pain, where their VAS score is 4 to 6 out of 10, then you start on step 2 drugs. When patient is having severe pain, your VAS score, visual analog scale, which is the scale to assess the pain severity, then you start on step 3 drugs. It is not necessary that you have to climb ladder from step 1 to step 2 and step 3. Suppose when patient comes to you and he is having severe pain, his VAS score is 7 to 10, you can jump to step 3 and start the drug which are mentioned in the step 3 like morphine and fentanyl. What are the advantages of this guideline? It is very specific and very structured way of giving analgesics, and there is a flexibility also. It is not necessary, as I said, you go from step 1 to 2 and then 3. You can start at step 2 also, you can start at step 3 also. Then drug is selected as per intensity of the pain and not by etiology. The etiology may change. In initial stage of the cancer, patient may have different etiology, in advanced stage it is different etiology, but by severity of the pain we are deciding the drug. This ladder can be used to some extent in non-cancer pain also, like patients suffering from arthritis, knee pain. If it is mild, you can give step 1 drug. If it is moderate, you can give step 2 drugs. After treatment, reassess the pain response always, because you might have to change the dose of the drug, and you can give maximum dose of the drug till patient gets minimum side effect. If side effect increases, patient develops some complication, you may decrease the dose and choose for the some alternative treatment or alternative drug. In children, as I said earlier, this step 2 is omitted, because these step 2 drugs are causing too much of side effects of nausea, vomiting in children. So, for children it is always step 1 and step 3. So, step 1 you can give paracetamol or ibuprofen, both are available. In step 3 you can give, pain child has moderate to severe pain, you can give morphine, straight away morphine. So, do not use tramadol and codeine in the pediatric patient. How to use, as we said earlier, as per the disease progression and intensity, severity of the pain, you have to use the ladder. Suppose patient has mild pain, then you give non-opioid drug, in which you are not using any narcotic, and along you are using only paracetamol, brufen, and give adjuvants drug along with it. Like in brufen, patient will get gastritis, so you give ranitidine to decrease the gastritis, acidity, like that. If patient is not relieved of pain, then go to step 2. Step 2 is for the moderate pain. In this you use weak opioid, again narcotic drug, but weak narcotic. Here we are in adult, we are using tramadol and codeine or codeine, and again combined with the paracetamol, which will be complementary therapy. Still patient has pain, pain is not relieved, then you can go to step 3, which is for the severe pain, where your VAS score is more than 7. Here you use strong opioids, strong narcotic drug plus adjuvants. So, strong narcotic drugs are morphine, oral morphine, and there is one recently, not recently exactly, but new drug fentanyl patch available, which is very costly, but still it is used as a step 3 drug. These are the list of various drugs you use in the WHO ladder. And these are the dosages which are described, which you may not remember, but this is just for your knowledge, that these drugs are given in the maximum dose possible with minimal side effect, and it is to be given round the clock. So, to conclude, freedom from pain is a human right. It is every patient's right to get his pain relieved, and pain is these symptoms which makes patient attend a hospital or to see a doctor. 80% of our OPD patient has first symptom is pain. If there is no pain, many of our patient does not come to go to doctor or does not attend any hospital or dispensary. So, when patient comes to you with pain, it is his right to really get relief from him and freedom from pain. And current WHO leader emphasize on pharmacological aspect for pain relief instead of non-pharmacological therapy and non-opioid therapy. As mentioned earlier in both the lectures, that it is to be given by mouth, by cloak, by ladder, by individual, and more realistic approach should be taken up when you want to treat cancer pain by WHO analgesic ladder. Along with that medicine, the most important thing one can do is communication and counseling. Without this, patient will not accept your medicine up to the way you want them. There will be lack of compliance. If you just dispense the medicine and tell him to go away, he will not understand how to take, and there will be lack of compliance. He will not stick to your regime. So, good communication, making him understand his pain, making him understand the treatment you are giving, making him understand the side effect it is likely to cause, and how to take medicine. All these are very, very important part along with your prescription. Thank you very much.